So today I'm going to talk about cortisone injections, which are a very important part of my management strategy as a shoulder specialist. Given it in the right place, in the right way, and for the right reasons, they can be hugely effective, both at helping me understand the diagnosis, but on many occasions also curing you long term. And people worry they're going to, once they've started injections, they're going to have multiple injections. I would say, no, we would never give more than 2 or 3 a year. And if it gets to the stage where we seem to be giving you multiple injections, then really we ought to be changing strategy and thinking of different ways of managing your problems. So cortisone works by being a very strong anti-inflammatory drug. It's a bit like the anti-inflammatory tablets like Brufen that you can buy over the counter, except that it's administered to be delivered by injection into a particular part of your body, and once it's injected it stays where it's injected and works very effectively as a very powerful anti-inflammatory in that area. So if inflammation is a potent source of your pain, and it frequently will be, then a cortisone injection can be a really good way of giving you a relief of that pain. Now, if it only works for a while, it may just at least give you an opportunity to engage in proper physiotherapy, which will be the mainstay of your cure. Or it may be that you have a condition that is all about inflammation, frozen shoulder, calcific tendonitis. And if we can dampen the inflammation, we can cure your symptoms long term. So we have to take a bit of care when we're injecting you if you've got diabetes. The cortisone can put your blood sugar levels up and make you a bit more resistant to insulin. So if you're an insulin dependent diabetic and you measure your sugars very carefully, you will notice it's a bit like being ill, and that effect can go on for several days. It's not dangerous, it won't push you into a DKA, but you do need to be aware that you may need to be giving yourself a bit more insulin, or at least be aware that your blood sugar readings are going to go up for a few days. Is it okay to drive after injection? Yes, absolutely, it's fine. As long as you don't feel faint and you're not in pain excessively and you can safely control the car, yes, absolutely fine, so everyone does. In terms of return to sport, that very much depends on why we've given the injection, but what I would suggest is as soon as you feel the injection is starting to work, and certainly I would expect that within a few days, then you can get back to doing sport or work as soon as you're comfortable to do so. I'm often asked, how long is this injection going to last? And the answer to that is, I don't know. It depends very much on why you're having the injection in the first place. If, for example, you're having an injection because you've got a very inflamed shoulder, perhaps you've got this horrible condition called acute calcific tendonitis, then I would expect this injection will settle all the inflammation, and once the injection's working well, the inflammation's settled, you shouldn't have any recurrence of problems at all. So you might say that injection has worked forever. There are other conditions where the injection may need to be repeated because the inflammation lasts longer than the effect of the cortisone. So for example, if you've got rotator cuff impingement, rotator cuff tear, or frozen shoulder, those might be examples. And there are other cases where I would think perhaps the injection may not last much more than just a few weeks, but where it's still useful to do. A good example of that would be if you've got pain from your acromioclavicular joint. That's up here where your collarbone and shoulder blade meet. And sometimes I would give an injection into that joint just to work out if that joint is indeed the source of your pain. So if you were to return in a couple of months, say, and it had been really effective for a few weeks but then all worn off, you might not think that's been a terribly useful injection, but for me that's very good information to know at least that little joint that I injected is the source of your trouble, and we can then talk about alternative ways of addressing the problem long term. Asked about the potential side effects or complications of giving a cortisone injection, and thankfully they're pretty uncommon. Most of the problems come if the injections are put very close to the skin, such as around the elbow, where they can make the skin go thin and they can actually cause changes in the pigment within the skin, so the area that injected can look paler or even whiter. Now we're putting the injection deep into the shoulder joint, that's so far away from the skin, it doesn't seem to be a problem. There is a small risk of allergic response, but that's incredibly rare, and there's also a very, very small risk of infection, although I have to say I must have given tens of thousands of cortisone injections and I'm not aware of ever having caused that before. So when we give the injection, you won't find it too painful because we'll mix it with local anaesthetic. You may, however, find that your pain gets worse for a few days, up to 3 days. That doesn't always happen. It doesn't happen in every time we give you an injection, but just sometimes. And we call that a flare. It doesn't last more than 3 days. While it can be quite unpleasant, it's not serious, and it's perfectly safe to take whatever painkillers you would normally have at home on top of what I've just given. After 3 days, things will settle down, and I'd be quite happy for you then to get back to normal life and activities, even sport, as quickly as you feel your shoulder is up to embarking on something new. And ultimately, it's really important that you have taken your shoulder for a good test drive after the injection, because there's no point coming back for a follow-up appointment and say it's all been brilliant, but then you haven't really challenged it, so we don't really know whether the injection was effective or not. So you may have heard that cortisone injections can be painful, and if they're put into an area of the body that's very close to the skin, like around an elbow, for the tennis elbow, or into the sole of the foot, or into the hand, yes indeed, they can be really uncomfortable. But in the shoulder, it doesn't seem to be such a problem, and for most of my patients, they say the anticipation of the injection was far worse than the reality of actually having it done. There are a few occasions when we wouldn't want to give you a cortisone injection. The first is if you've ever had a history of anaphylaxis or bad allergic reaction to previous cortisone injections, although in fact this is fantastically rare. The second is if you might be in the early stages of pregnancy, it's something we ought to discuss, or if you are breastfeeding. Again, although it's safe, it might be something that you'd prefer that we discuss. And the last time that we would not want to give you an injection is if you've got active infection. Now, cortisone injections me and my team give will all be done under ultrasound guidance, and we're experts at doing that, so we can make sure that when we give the injection, it's put in exactly the right spot.